Cloudcast Media. Drew Schlosberg Spotlight on the Community Show, amplifying the voices of social impact organizations, entrepreneurs, local nonprofits, and other community champions who shape the culture, creativity, and connectivity of San Diego. Brought to you by Mission Fed Credit Union, bringing good things to San Diego for over 60 years. Learn more about what is good for you and good for all by visiting www.missionfed.com.
I'm Drew Schlosberg of Cloudcast Media. It is always a spectacular day when we have our friends in from the McAlister Institute. An honor to have with us Dr. Jim Dunford. He is the medical director for this venerable organization that has been just doing marvelous things since 1977 and continues to do them. Dr. Dunford or Jim, how do you want me to call you?
Call me Jim, please.
I'll call you Jim. How long have you been with McAlister Institute?
Oh, officially for about 3 years now.
For 3 years. Talk about its mission for those zero people that have never heard of you folks on our show, because we've spotlighted that absolutely beautiful Gene McAlister for so many years. What's the mission of the organization?
Our mission basically is to bring hope and encouragement for recovery from addiction. To make a long story short, we believe that people can find recovery from these conditions that haunt them, and that there are prevention efforts as well that can stop this in its track from even taking place, because it's so destructive on families and the community.
Yeah, without question. How many different facilities you folks have? Jean started in 1977. She's very proud to say she's recovering. Substance abuse or alcohol, I think, was her preference. She's been, I think, sober for 65 years. Am I off on that?
No, that's about right.
Yeah. Exactly. But how many different facilities you folks have?
Oh gosh, we're adding all the time. I think we're up to 27 programs right now.
It's unbelievable, all throughout the county, right?
Yeah, we contract with the counties, so there are designated areas that the county wants us to participate, especially North County, East and South.
Right, exactly. October is Substance Abuse Prevention Month, but don't have to tell you this. Every month should be. It doesn't stop in October, and so forth. I ask Gene this question all the time, and I'm going to ask you as well. And are we making some inroads here? You guys do great stuff, but are the numbers going down? Are they flattening? Are they going up?
Tragically, I think they're going up. Right. And of course the headlines are talking about the overdose and death rate, right? In particular, that highlights that. But the good side is that we may be making a little bit of progress in the stigmatization and trying to eliminate that. We are trying to move people into a treatment that's going to be beneficial to them, and a lot of people are afraid to because they don't want to admit it, or somebody else doesn't want to make that referral for fear that they're going to be stigmatized.
You're so spot on. And whether you're talking about, substance abuse, or you're talking about mental health, which you certainly know very, very well, or you're talking about something, that stigma, which curtails people, and I'll say this, one of the organizations I'm near and dear to my heart, and have been for many years, is the San Diego Council on Literacy. There's a significant amount of folks in any major city that are considered functionally illiterate, but to almost the point you're talking about in your world, the same thing in literacy. I don't want people to know that I'm functionally illiterate, therefore I'm not going to go get help.
Yeah, that's exactly right. It's a kind of a vicious cycle,
right?
And it's been perpetuated for a long time. People have basically kept these things secrets when in fact there is treatment out there. That's part of the message today is, hey, come get help or refer people. It's not that hard.
It's not that hard, and you got people, like you and Jean and this unbelievable staff she puts together that are with you shoulder to shoulder. Jean says this all the time, bless her heart. You want to call me at 2 a.m? Call me anytime you want. Here's my cell number. I'm with you. And, and she means it, does she not?
Oh, yeah. You can be in her office and you routinely get a phone call from a mom or from somebody that says, I heard that this 4 o'clock yesterday afternoon, somebody who needed to get in, literally facing the possibility of going back to prison if they couldn't get into a program within the next 48 hours. And Gene was going to bend over backwards to help that person.
It's interesting to me, we're chatting with Dr. Jim Dunford. He is the medical director for McAlister Institute. I'm Drew Schlosberg. You're listening to Drew Schlosberg Spotlight on the Community Show on Cloudcast Media, brought to you by Mission Fed Credit Union here in the Mission Fed studio in Scripps Ranch. And Mission Fed's been bringing great things to San Diego for 60 years. And you brought something up that's so spot on. So here we are, got this great institute that since, 1977, if I'm doing the math right, that's been doing it for a long time and, has great outreach throughout the county. And saving people, one, is important. And of course, maybe you can address this in a few seconds also. It's not just the person who has the addiction, it's their family that benefits from all the services that you do as well. But think about it. So you have these great programs and services that work, shock, right? Mm-hmm. And I guess if we keep somebody out of jail at $70,000 a year times how many years, if nothing else, isn't that going to save me as a taxpayer money?
Yeah. I mean, it really, no matter which way you like to
right.
view the world, if it's dollars or if it's saving lives, or
that's right.
It's the same 25-cent piece.
That's right.
Heads or tails, it's all the same.
That's right. Exactly. Talk about, you had the recent 10th annual Walk for Sobriety, which, to the point, just brings people out to say, it is okay. We are here with you. How does that go this year?
Oh, it's great. Yeah, we hold this once a year down at Liberty Station.
It's a great place.
We have people that, come out, their teams, their families, everybody supporting them. Everybody's wearing a badge that says how many days, weeks, months, or years they've been sober.
Right.
And it's a very inspiring moment. And everybody ought to come to that if they have any, desire to learn more. It's chock full of all kinds of vendors and ancillary people in the community that are all dedicated to the idea of dealing with behavioral health issues, which they're all intertwined, of course.
Well, and they are. And, I think, as we talked about, when you are, helping that person who is addicted, and of course you're helping all their circle of influence and their friends as well on it. But I think, just life in general, this, when people know they've got somebody in their corner, that means so much, does it not?
Oh, yeah. Right. You have to have somebody you can trust. Most of the time, people are just filled with anxiety when they have these conditions. Right. Remember, these are brain changes that have occurred as a result of addiction. These are illnesses. And we oftentimes try to remind people, you wouldn't shun somebody with diabetes in the family. You shouldn't do the same thing if they have alcoholism or some other substance use disorder.
Well, it's funny. We say this quite a bit on our shows, whether we have mental health systems on or we have the McAlister Institute or anything in between. We don't sit there and point to someone, look, you got a cast on your arm, you broke your arm, what the heck's the matter with you? But we do the same if you were seeking some help with substance abuse or mental health. It makes no sense. Yeah. Of course, humans don't make much sense. How did you get involved in this? Is this something that always were doing when you got your medical degree, or you morphed into it?
I morphed into it. I was the medical director of the city of San Diego for 30 years.
Yeah, congratulations.
And I was an ER doctor for almost 38. And so what I saw coming in the door at UCSD Medical Center was what we're talking about today. And I got interested in this issue 20 years ago, really, through a program called Serial Inebriate Program, where we were trying to address the fire department and the city attorneys and everybody trying to tackle a really difficult problem, which was the chronically homeless individual that was wrestling with alcoholism.
Right.
And we built a team and we created a national model that actually has been emulated all over the country. And it was so successful, I started thinking, wait a minute, there are a whole bunch of other issues here. Most of the patients that we were talking about, they were using the ambulance systems repeatedly, had mental illness, substance use disorder, and homelessness. It was the trifecta. And so when I retired from emergency medicine, I said, look, the one thing I know that's not easy to fix, but I've seen the teamwork that can actually create systems, and that's where I got going on this. I knew Gene, I knew the people at McAlister for a long time, and because they run the Sobering Center in San Diego, which is a wonderful place that does divert people from custody and bring them for a safe sobering rather than spending the night in jail.
Right.
And so I was really excited about getting together with McAlister. And also the state actually had gone through a revolution, if you will, in the way that substance treatment was being handled. There was a whole reform effort to kind of make it a more if you say legitimate way to take care of people with these addictions. And we were right at the beginning of that here in San Diego County. So it was kind of fun to get in at the begining.
You know, I so want you to hear that. We had our friends on from Second Chance not too long ago, and I'm not sure if you're familiar with Second Chance. And they work with people that have been incarcerated, so they don't have recidivism. I think if you don't have any, interventions, like 70%, and again, the same thing we're talking about. And they were talking about how they're working very closely with the, folks in the prison system and Justice Department to relook at how they work on this, to reduce the amount of people. Just don't throw them back in jail and all this business. Here's some things to do. And so what you're talking about. Yeah. Do you see a lot of inroads with people rethinking these things?
Oh, yeah. I also worked in the jail 8 hours a month for about 20 years.
Oh my goodness!
Yeah, that was part of what we did. So I would come home many, many times and tell my wife, of the 25 people I saw this morning, 3/4 of them had mental illness and substance use, and that's why they were in jail. And it was over and over. So that finally resonated with a lot of people. I think the cost, if you only just go back to like driving factor here, but also the fatality rate, it's just extraordinary what happens if somebody's been addicted, goes into a custody situation, comes back out and uses one more time, they die because they've lost their tolerance. And so the fatality rate was extraordinary as well. And so, I think up and down the whole food chain, all the way to the federal government, there's been a push to really think about this as a disease, and let's not add punishment on top of whatever else somebody maybe does deserve to be in custody for a little while. But let's be humane about it, and let's treat them, and we'll save money in the long run as well.
Right. We're chatting with Dr. Jim Dunford. He's the medical director for McAlister Institute. I'm Drew Schlosberg of Cloudcast Media. About the unbelievable work that's been going on with the Institute since 1977. Jim, when we come back from break, I want to talk about, your 24 programs, and, you have a continuum of care that really hits not just one aspect, it hits all these aspects: education and outreach and outpatient treatment and short term. And when I talk about that, also want to really hit high on something that is in the news every 5 seconds about fentanyl. You've seen this through your career. It's okay. What is going to be, unfortunately, the drug of poor choice for people? And fentanyl now seems to be this in 2022, probably even before that. And then we always spend time in the second half, Jim, what can our listeners do to support your efforts? And as far as I'm concerned, McAlister Institute, everyone should be directing so much attention to volunteer, or donate, or whatever when we return. How's that sound?
That sounds great.
Good. We're going to be right back with Dr. Jim Dunford, medical director for McAlister Institute. I'm Drew Schlosberg of Cloudcast Media.
When you do your banking with Mission Fed, you get great rates on auto and home loans. That's good for you, but something good also happens for a lot of other people. We're not for profit, so we put money back into the community to help lots of great nonprofits to keep San Diego strong. So you're not just getting something good, you're doing something good. Come to Mission Fed. It's banking that's good for all.
Brand amplification is the DNA of Cloudcast Media, and our code is the powerful blending of sound, voice, and storytelling to lift local brands and their communities. Whether it is our Brandcast, Schoolcast, or Causecast platforms, the unifying ethos is all about this community, the one you call home. If you dare to dream and want to explore the brand amplification of Cloudcast, a national leader in local podcasting and other Winfluence strategies, please visit us at cloudcast.us.
I'm Drew Schlosberg, and you've been listening to Drew Schlosberg's Spotlight on the Community Show on Cloudcast Media, brought to you by Mission Fed Credit Union, bringing great things to San Diego for more than 60 years. We're honored to have in the studio with us Dr. Jim Dunford. He is the medical director for the venerable McAlister Institute, and just talking about their relatively recent 10th annual Walk for Sobriety. Right before break, we were just talking about these 24 programs you have that have just a continuum of care, just not one aspect. You care for the whole person. Talk about that.
Yeah, we are very proud of the fact that we do kind of span the whole spectrum. We have programs in high schools, for example, and the county actually, again, sees that these programs exist, but we're very proud of our teen programs that can sort of nip it in the bud, if you will, the kids that are already getting into difficulty with the usual things, unfortunately, being cannabis and alcohol, and sometimes stuff that's actually nastier than that.
Right.
We have women's programs, which are wonderful. We have a program, a 90-day residential program for women with their children that can actually live with us. We have adult programs for guys that are coming out of custody. We have a whole variety of large regional recovery centers that are outpatient programs that people come in. During the pandemic, we managed all that through telemedicine.
Right.
And then we take care of the really rough situations. We're the contractor for the people that are coming straight off the street that are actually going to kick heroin or methamphetamine or some of the other stuff that's out there. And we institute programs in partnership with our colleagues in the clinics to get people on medicines right away so that they're not, so withdrawal is not painful. We can actually use Suboxone and some of these other medications to really get people under control and really start to have a second look at what they've been doing.
Right. Are we, we mentioned earlier that, and Gina said this too, unfortunately, that it seems like each year things are increasing a little bit. And I asked this question, and, but may or may not, tie into it, but does our high cost of living, which really has an impact on a lot of things, can you afford to, house yourself, does that add to the stress, which adds to the fact that you want to escape by taking drugs and so on? Or is that no relation there?
I think what people have come to recognize, especially about addiction, is that trauma is an underpinning of all sorts of these behaviors. And I think that, economic trauma is very real. There's no question if you grow up in a household where the parents aren't around, for example, because maybe they're both struggling to get enough money in to be able to feed kids. These kids are unattended and essentially parenting suffers, and there you go.
Right.
So, I think the high cost of living at any level of the economy is actually impacting the way that people are responding to it. And, alcohol sales and things are up, right, during the pandemic.
Right. And then, it even ties a little bit into, we had a shows on about domestic abuse. And now the perpetrator, or the person who was being perpetrated is home because everyone's home, right? And now, which opened up a whole bunch of interesting ideas. I mean, it's bad enough that if they were working, they had to come back home to an abusive situation. But now they're home the whole time.
No, I mean, when I review close to 100 charts a week of intakes, and I would say that it's rare to not encounter a woman who doesn't report a history of domestic violence.
Right.
I mean, it's staggering.
It is.
And many times it's been through multiple prior boyfriends or husbands. These are real events that people have never recovered from. And a lot of times drugs it's partly a use of shame and trying to get away from that. And it takes therapy. And we actually have that therapy. We use art therapy and all kinds of expressive therapy to get people to come to grips with the past and also to realize, hey, that is in my past. I'm not going to ignore that, but I also am an adult who can cope with that now. And it's that coping skills in addition to the medications that actually is what is the key to success.
One of the things we always chat with, and you're a perfect person to ask on this, if somebody suspects, that they have a family member, a friend, doesn't make acquaintance, whatever, that, is struggling with this, and they don't feel like they want to address the person, okay, can they call you folks?
Oh, yeah, absolutely.
And because I think that's part of it is, you see something, staying silent doesn't help anyone, does it?
That's the worst thing that you can do. Yeah, you should speak up. I mean, one of the most powerful things, if you won't do it for yourself, do it for someone you love.
That's right.
Yeah. So that is a key concept of getting things better is acting on behalf of somebody else or someone acting for you.
Right. And that's what I think that is so, important, in that vein is really getting people to know with anything. You don't pick up the phone, okay, and again, and help your loved one out, it rarely is going to be taken care of and all that business. Where do you see, when you folks are getting your funds, is it state, is it grants, is it individuals, is it corporations, is it all of the above?
Well, being a nonprofit and essentially contracted primarily with the county for all these services, but we certainly accept gifts, donations, and charitable contributions. You bet.
Right. Yeah. Do you need volunteers at all to work in those places you have, or certainly for events like the Walk for Sobriety?
Well, we raise a lot of money, or we try to, for the Walk for Sobriety, and so that's a wonderful spot if people are interested in helping us. We do have on our website, McAlister website, an opportunity for people to donate. Yeah, and we do receive some really wonderful gifts, many times because people have seen the success that we've had with somebody in their family.
Right. We're chatting again with Dr. Jim Dunford, the medical director of McAlister Institute. I'm Drew Schlosberg of Cloudcast Media. We make this offer, and some people can take us up on it, and some people can't for some privacy issues or HIPAA issues or whatever the case may be, but some folks manage to do that. And I'm not sure if we've done this with Gene at all, but would love to, if you have someone that has benefited from your services or a family member that's benefited, and we don't have to use first and last names, we can make up names, but we always love to have these are people that have benefited from those services. Would you be able to come back on and bring someone?
Yeah, we'll sure do that. Yep.
Okay.
There's nothing like lived experience, as I say.
Yeah, exactly. What else can our listeners do to support your efforts, Jim?
Well, talk to your kids. What we want to do is get to kids and especially mitigate this issue of the fentanyl overdose that are happening. There are some horrendous new products that are coming right now. There's one called Rainbow Fentanyl that everybody needs to be aware of. The cartels are manufacturing fentanyl as pills that look like candy. And it is frightening to think about this. In addition, there are new drugs that are popping up on the East Coast that are even more potent than fentanyl that are responsible for multiple deaths. The bottom line is kids have got to learn how to say no to things. And parents need to be open and honest and casual and trusting and loving and all the good things that parenting does. But they should also talk to the kids about maybe even creating a plan. What would you do if somebody offered you a pill? Let's think that through before that happens.
Right.
What a good idea to do, and keep it open and ask kids, what do you know about fentanyl? So that the kids are willing. They want the guidance. And so honestly, if I could get back to the beginning of this problem, I'd say, let's not let another kid die.
Right. So that advice you just gave right now, is that something they can call you folks for and you can help walk a family through this?
Sure. That's all. Yeah, call McAlister's. We're happy to kind of provide guidance in general and especially to refer people. The screening process to identify if somebody has a problem or not is not that hard. It can be done over the phone sometimes to figure out what level of care do you need.
Right.
It can range anywhere from once a week coming in to you need to be in a residential program for the next 90 days, or you need to kick this right now, and we're going to try to get you a bed as soon as we can.
Good. What's the website for McAlister Institute?
McAlister Institute.com.
You know what?
.org.
And if not, it'll find you. Jim, what a pleasure. Thank you for coming in, and please do me a favor and give a big hug to my friend Jean McAlister. I think the world of her, and now it's an honor to meet you, and would love to have somebody that's benefited from some of your programs and services have you come back on sooner than later.
Let's do that. Okay. Thanks a lot for having us.
It's absolutely our pleasure. We're talking to Dr. Jim Dunford. He's the medical director of McAlister Institute. I'm Drew Schlosberg, and you've been listening to Drew Schlosberg's Spotlight on the Community show on Cloudcast Media, brought to you by Mission Fed Credit Union, bringing great things to San Diego for more than 60 years.
You've been listening to an episode of Drew Schlosberg's Spotlight on the Community show, amplifying the voices of social impact organizations, entrepreneurs, local nonprofits, and other community champions who shape the culture, creativity, and connectivity of San Diego community. Brought to you by Mission Fed Credit Union, bringing good things to San Diego for over 60 years. Learn more about what is good for you and good for all by visiting www.missionfed.com.
Cloudcast Media.